Hey, Dr. Shannon.
Hi, Dr. Maura.
So we're excited to be here, right? We're talking about our new sort of functional approach to fertility, which is a program called the Integrative Fertility Blueprint. So super exciting. We've been developing this over probably years now. You and I both have been treating a lot of people, couples, women, working around fertility. It's a area that's near and dear to my heart as somebody who's gone through pregnancies in my 40s, and I'm very sympathetic and love working with women and their partners around this piece. And I know you've been doing this work a long time as well, and so it's exciting, and we're excited to apply naturopathic principles to an area where women, I feel like, right, don't get a lot of answers, who are struggling with this. I think that was one of the primary reasons we decided to put this together in a cohesive package, right?
Yeah, the program we've built here is really great at looking at the whole picture of what's going on. We do the Dutch testing, which looks at not just the hormone component, right, which we know hormones play a huge role in our fertility, but also the metabolomics, where we are looking at nutrition, a patient's overall nutrition status, and how that affects things like their antioxidant or oxidative stress level, I should say, how their mitochondria health is, overall inflammation in the body, as well as some of their toxin exposures that they may be experiencing as they're going through their fertility journey. And we're able to take the information from both of those tests to make a really unique, comprehensive treatment plan for these patients. And
Mhm.
then the beauty of it being 4 months is we have 4 months to correct what we see on those labs. And we have 4 months of checking in with us, with providers, and helping patients stay accountable and answer all their questions as they go through this process.
Yeah, it's a tricky, and it can be confusing and a bit isolating, right, to go through a journey around fertility. So, people have total access to us, every step of the way, whether they're trying to conceive naturally or they're going, a route through IVF or IUI. So that's a great part of it. And as you mentioned, the O testing, the metabolomics, we do Dutch as part of the functional testing. We also do comprehensive blood work, which we know a lot of people have done stuff, or done, blood work with their reproductive endocrinologist. We're adding our more functional look at that, right? Which is a very comprehensive full body approach, which, as we always talk about, hormones are important, but our endocrine system lives within our body, right? Everything is going to be impacting the way our hormones function, whether it's gut health, thyroid, all, inflammatory levels, which is why, again, we do blood work and we look at food sensitivities as far as tailoring diet, right? That's one of the things we talk a lot about with patients. It's like, what do I eat? What is optimal here? And that, I think, varies widely from person to person. That's why we like getting a little bit of a directive about, foods that are kind of creating inflammation or not, right? So,
Definitely.
so it's very tailored, individualized is like kind of the big name of the game.
Yeah, definitely. And I think that's kind of really what naturopathic medicine is treating each person on a case by case basis. There are a few things that we do kind of foundationally for everyone that we know are on a fertility journey, which can be seen when people are looking at the package, the supplements that we do include. Those are kind of our basic starting off points.
Mhm.
And then, yep, once we get all of the test results back in, we can tailor not only supplement recommendations, but diet, lifestyle, mind body recommendations as well to really make sure we're treating the whole person. And then again, one of the benefits of the length of the program is you have 4 months to incorporate these changes and improve not only your hormone health, but your overall health and well-being. That sets you up not just for conception. I think that's also a really big piece of this is
Yeah, really important.
preconception care is not just to conceive, it's for a healthy pregnancy and then also, a smooth and successful postpartum period, which we know
Right.
so many women struggle with as well.
Yeah, exactly. That we always say like a healthy postpartum is built before getting pregnant, and throughout, right? So it's really setting women up for this entire journey. Yeah, it's exciting. We love talking about this, and we're excited
Yeah,
to implement the program. So thanks a lot, Shannon.
thank you.